I'm on. So, you ask
introduction, who you are, and talk about how IHELP Foundation is, and why did you take interest to come to Uganda and partner with KCM on this camp?
You bet. Thank you very much. So my name is Bill Betz. I'm an emergency room doctor in the United States in the state of Utah, and we started the foundation called IHELP Foundation. We've been doing this for about 20 years, and we travel around the world working with different groups that are great groups that are very well organized, that have a good history of taking good care of people, with a good financial history that we know and we trust them as people and as an organization. And then we come and try to do the medical and help with the dental part of that, and then also help build that community the best that we can. So we've been all over the world, but some of our good friends, Taylor Mendenhall and his friend Dylan, they met Peter because of one of the children that they sent over to Utah. Another doctor of mine that was a friend of mine had helped that child with some of the needs that they had after that they had been hurt and abused. And so that's how we got to know each other. And so we met with Peter about 6-7 months ago. He told us what he was doing, we explained what we do, and we felt like it was a really good match. And so we decided at that point in time to start looking towards coming to Uganda. This is our first time here, but we love it. Absolutely wonderful, beautiful people, fantastic reception that we've received, and we just have loved being here in this country and working with KCM. We could not be happier with the organization and with the country. Just absolutely fantastic.
How many patients so far have you worked on?
I think we are a little over 700 patients at this point in time through the medical side, and I think there are around 200 patients in the dental side and in the eye clinic. And then we have some that are coming back for other visits. We anticipate that we'll see around 2,500 patients in the 2 weeks that we're here and seeing those patients.
Comparing general checkup and then dental, what's the commonest reason have you found out that's maybe people are suffering from? Is it dental? Is it general body weakness? What
We're seeing a lot of different concerns and complaints. A lot is general body weakness and pain, especially those for all the years of walking and carrying heavy things. And so we're trying to work a lot on some education of some exercises, some stretches, and some other medicine that can help with those pains. But we are seeing a lot of dental problems as well. A lot of people that need some teeth extracted or fillings put in, and working with a great group that's here helping with that. And then otherwise we're seeing a lot of high blood pressure and diabetes. We're seeing a lot of both of those, and then also infections, skin infections, urinary tract infections, coughs right now. Luckily not seeing a lot of COVID, which is good. That seems to be also decreasing as well right now in the country of Uganda, which is very nice. But so a lot of the general things, but I would say that the most thing we're seeing often is, infections, and then lots of aches and pains in the body, and then a lot of dental.
Where do you send patients after examination? Do you refer? Do you have like a pharmacy somewhere where you send them?
That is an excellent question. That is actually one of the most important questions for us, is we don't want to come into a country and pretend like we know what the country needs. We know that the people of Uganda know what Uganda needs more than we know. And so we love to partner with people, and so that is what we hope to do, is as people need referrals, after we see them, that we have a few of the doctors here. We have 3 local doctors from Uganda that are here working alongside of us, and so that they can continue on and see referrals for those patients. If we need to go get x-rays or other blood work or testing, that they can get those referrals, they can follow up there, or if we need a pharmacy that they can help. And KCM has been helpful in that, with us getting all that arranged as well. And so that's really important for us wherever we go, and we want to have a good partner that can help that knows what your needs are, that can guide and direct our efforts so that we can be of a help to the Uganda people.
What happens if someone is examined with a very serious issue? Do you give this person money? Do these people pay anything to get treatment? What to do?
That's a great question. No one pays any money to come be seen at our clinics. We pay our own way to come here, and then we also buy all the medications so that everyone gets all the medications. If they're sick and need medications, it's for free. We ask that they will be responsible with that medication, that they'll be responsible people to help others around and to serve them and care for them the way that anyone would. We've seen that very easily in the Uganda people. They're people that cares about each other and cares about each other being healthy and happy, and so it's very easy for us to want to be able to give in that way. But yes, no cost for our services and no cost for the medications that we bring. But there are some that when they're very ill or very sick, we can give some IVs, we can do some IV antibiotics and help them, but some we need to refer to the emergency room at a hospital or immediately to another clinic. And so we've done that a few times today. But we've been able to fix a few broken bones. We've been able to help some people in some pretty serious conditions. As I said, I'm an ER doctor. We have an internal medicine doctor that we work in the ICU, so we kind of are used to a really high level of concern, so we can treat some of those, but we want to make sure they have good follow-up with the people that they need to see.
What's next for IHELP Foundation?
What's next? So for us, what's next? This week we're here. Next week we're in Jinja. We'll be there all week with the Mapendo Packer Clinic. And so our friend Susie that we met up there, will be our first time coming to that location as well. And then into the next few months we'll be in Guatemala, Haiti, El Salvador, Honduras. And then also we have a refugee clinic in the United States where, if you're seeing the news, there's a lot of people from Ethiopia and Afghanistan that are coming and they're staying in the United States, and we're able to see them and care for them there. So we see them every few weeks. And so then for me it's back to work at the regular hospital that I work in and back to my family and children. Is that good? Whew! That wasn't too hard.